if you take radiology, there might be a possibility that you do not get a job because the jobs in radiology are getting saturated. Now, this is a very common myth and a very common rumor that has been going all over the internet lately. I get so many personal messages on Instagram, and there is a trend going on Twitter that radiology is getting saturated. You will not find good jobs in radiology in the near future. You should not take up radiology as a top branch in this NEET PG counseling. In this video, I want to burst this myth with some facts with my personal experience in this field for 5-6 years now, and I would try to cover important points as to what is the state of radiology currently in tier 1, tier 2, tier 3 cities. What is the state of AI? I'll briefly touch upon AI in this video. I'll make a whole new video about AI separately, and whether you should consider radiology as an upcoming branch or as a dead branch in future. So just a brief introduction about me. I'm Dr. Rishabh Jain. I did my MBBS from AIIMS Delhi and my PG in radiology from prestigious PGI Chandigarh, and now I'm currently pursuing intervention radiology in New Delhi. So before you take up any branch in this NEET PG counseling, be it medicine, radiology, ophtha, derma, surgery, whatever, I want you to focus on this very important concept called Ikigai. That this is a Japanese concept which tells you what brings the ultimate happiness in one's life, what gives a purpose of living to one. So you should do what you love, what the world needs, what you are good at, and what can be paid for. So if you find a specialty, if you find a branch which covers all these four concepts, you're doing a specialty that you love, which the world needs, which can pay you decent level to sustain a living, and you're also good in that specialty, believe me, you'll be happy for the rest of your life. You'll really enjoy doing that, and it does not matter whether it is radiology, medicine, ortho, derma, surgery, whatever. Okay, just remember these four things are the crux of a happy life according to a Japanese concept, and I truly believe in this. Now, let's get first thing first clear. So, will you get a 5 to 6 lakh per month package after doing a PG or an SRship in radiology? Will you get a 5 to 6 lakhs package? The answer is no. Okay, the answer is no. You will not get such lumpy bumpy packages now in radiology. Maybe there was a time in early 2000, from 2001 to 2010, when such big packages were the norm, but currently it is not the norm after SRship. And for that matter, it is not the norm in any medical specialty or super specialty after PG or SRship, let me tell you. So the biggest opponents of radiology that I see on the internet actually fail to provide a counter argument for other specialty. They say that the money in radiology is saturated, but that is true for other branches as well. It all depends where do you want to settle. So is radiology saturated? Will you get jobs? It depends where do you want to settle. So if you want to settle in tier 1 metros, Delhi, Chennai, Bombay, Bangalore, Hyderabad, there are big shots, there are big centers, there are big setups, big hospitals. A lot of radiologists are there in these metros. So obviously the demand supply mismatch is not there, right? So the pay of the radiologist for a 9 to 5 job will be less. So what are the rates typically in a tier 1 city? If you ask me, the current rates are between 2 to 2.5 lakhs. Between 2 to 2.5 lakhs per month. This is per month in tier 2 cities. So for example, in north, if you go to, let's say, Dehradun, Jaipur, Lucknow, Meerut, so these are tier 2 cities. Here the packages for a 9 to 5, 9 to 6 job maybe will be around 3 to 3.5. Okay, and in tier 3 cities, so for example, in Haridwar, in Roorkee, in let's say Kapurthala, in let's say Rewari, Hisar, so in such cities, the packages will again increase more because there is still a dearth of radiologists. Believe me, a lot of radiology centers in these places are run by even non-radiologists. They are run by sonologists. They are run by people who are doing DMRE. Okay, so if you're doing a official radiology degree, believe me, you'll still get paid even in tier 3 cities. So what are the average packages? So I'll tell you my personal experience. The biggest center in my city, from which I got a package, was for 4.5 lakhs, and that is a tier 3 city. So the prices in tier 3 cities can vary according to the demand and supply mismatch there. So in my opinion, the salaries range from around 3.5 to 5.5 in tier 3 cities. right? So still the packages of radiology will be good, and there is still a dearth of radiology because now radiology has expanded a lot. Now patients come directly for a level 2 ultrasound. They don't even get a referral for obs and gynae because everybody knows that they have to get an ultrasound, they have to get a level 2 ultrasound in pregnancy. Now it is a very common knowledge. So the education of the general public about getting a radiological investigation is also increasing. So the work of radiology is also increasing day by day. Now pay will decrease substantially. This is the second common myth, the second common argument that I get on the internet, that 5 to 10 years down the line, the pay of radiology will decrease substantially. So this is, I'll agree to it partially because the number of radiologists passing out from medical colleges will also increase simultaneously. But again, it depends upon where are you settling. So if you are settling in a tier 1 city, let's say if you're settling in Delhi, there has been always saturation of radiologists. There has been always saturation of all specialities. Even if you are doing a urology, you are doing a neurosurgery, you are doing cardiology, gastroenterology, there are ton of these people in big cities. Radiology is no different. Now what people do, so if let's say they're getting 2 to 2.5 lakhs per month for a 9 to 5 job, so in the evening, let's say from 7 to 8, they'll do radiology, they'll read scans at some secondary centers, right? And they'll get another 1.5 lakh extra from that. So that covers up the deficit that earlier radiology used to pay. Now second option is teleradiology nowadays. So for a secondary income, for an extra income apart from the regular income, a lot of radiologists now do teleradiology to get to basically they work from home and report distant scans and get some extra money from there, right? Now the third argument is opening your own center is really expensive. It is not possible in current scenario because the machines come in crores. So yes, it is expensive, it requires a lot of capital investment, and the same argument holds for a lot of super specialities as well. So if you're doing, let's say, surgical gastroenterology, let's say if you're doing a neurosurgery, again opening your own centers in such a scenario is even tougher. Okay, at least in radiology, if you want to set up your own center, start with a smaller place, start with limited modalities, start with, let's say, an ultrasound center, do good level 2 ultrasounds, do good obstetric ultrasound, musculoskeletal ultrasound, and slowly and steadily build your practice so as to open a CT. Getting an MR is still difficult, and a lot of radiology centers don't get an MR because it is very expensive, but at least CT, ultrasound, X-ray, CT, a lot of small centers also employ these three modalities. Now, a lot of companies, say Philips, Siemens, GE, provide machines, let's say for CT, MRI, on profit sharing basis as well. So let's say if you are not able to pay the whole amount upfront, nobody is able to, in my opinion, frankly. Everybody buys machines on loans and slowly and steadily covers the operating cost while they're running the center. Now the fourth argument is AI will take up our jobs in the future, and it'll make radiologists unemployed. Now first of all, AI will replace. I agree. AI will come for a big amount, for a major chunk. AI will come with a bigger role in radiology in the future. I do agree to that. But in my opinion, it will only help us do our mundane tasks. For example, finding out lung nodules. So lung nodules are such a common occurrence in a general CT scan, and it takes a radiologist time to find them and report them. So if an AI algorithm automatically finds them and classifies it as benign malignant, it makes the life of a radiologist easier because there is such a huge workload of radiology. Second very common application of AI is, let's say, breast mass identification, automated BI-RADS reporting, let's say picking up hemorrhage on CT scans, brain CTs, etc., etc. It only increases the radiologist efficiency and makes him smarter. So I believe the radiologists have been smarter people, and only the smart radiologists who are able to incorporate AI into their reporting, into their practice, will really thrive in the future. And there is nothing to be scared of AI. I think we should embrace it if none less. Now, finally, I want to make some closing arguments that radiology currently has immense possibilities. So you can like specialize into subspecialties of radiology like fetal medicine. If you're good in fetal medicine, you do a good level 2 ultrasound. It is really very satisfying per se, and it also supports you really well. if you are into intervention radiology, if you during your MBBS you had a knack for doing surgeries, you like getting scrubbed in the OTs, so I'm sure you should explore this branch of intervention radiology, because you don't have much exposure to it in MBBS, but we are doing a lot of procedures in intervention radiology. So currently I am doing a fellowship in IR, and the whole gamut of the cases that we do in IR is like amazing. So from head to toe, we are doing mechanical thrombectomies for stroke, coil embolization for aneurysms. We are doing bronchial artery embolization for hemoptysis, tips for portal hypertensive bleeds, tips for refractory ascites and portal hypertension, peripheral artery disease, endovascular treatment. A lot of work is there in IR, right? So there are two DM also available in radiology now. Basically, there are three DMs currently. So one is neuroradiology, which was like the oldest DM to start in radiology. The second is cardiac radiology, and the third is intervention radiology. So these three DM programs are available after MD in radiology. If you want to super specialize, get associated with a hospital, do good reporting, do good subspecialty work, go for these DM, you will really feel satisfied. Now other options in radiology are like going to the Middle East. So Middle East has still a lot dearth of radiologists. They have good hospitals and they pay you really well, especially countries like Oman, cities like Dubai, Riyadh. They have good openings. They pay you well as a radiologist if you pass from India also. Now the third option is FRCR. So you pass the FRCR exams in your residency, and then you can practice as a radiologist in UK and Singapore. And finally is USMLE. Yes, after doing your radiology in India, if you are cleared by the USMLE ECFMG, you have to do some fellowships in United States to be eligible to give their American Board of Radiology certification. And if you are ABR certified, then you can still practice radiology in the US. So these are immense options that are available to you after you have done your MD radiology in India. And believe me, radiology has a lot of jobs still, and it will continue to have jobs in the future. AI will not replace radiologists, it will just make our lives easier to like get the mundane tasks already done. So let me tell you, when I picked up radiology 5 years ago, so 5 years ago, that was in 2018, still there was such a hype of AI taking our jobs. And believe me, during my residency, during my SRship, when I go in private, when I talk to my seniors in private, everybody is like doing very good radiology work, very busy radiology work, even though AI is there in the market currently, but it hasn't been able to replace us. It hasn't been able to take our jobs here, right? So believe in your passion. So if you like radiology, if you like cross-sectional imaging, you like anatomy, and you like sitting behind doors and doing some good work, so choose radiology. Cut the noise, hear the voice, follow your passion. All the best.